Hello, I'm Dr. Meenakshi Dua, Senior Consultant in Fertility at CK Birla Hospital for Women, Gurugram. And today I'll be talking about IVF procedure. Everybody, nowadays infertility is on the rise and many people are being suggested for IVF. Most of the people get worried just by listening that name that, oh, IVF, it's the last procedure should be done, and they get worried maybe something very big and something great which they are not ready. So let me just tell you about how the IVF procedure works, and it's not that difficult or any major surgery or any big thing which we are doing. IVF procedure normally starts on the second day of the menstrual cycle. We have a look at the hormones of the female along with the ultrasound. If everything is all right, everything is balanced, then we start with injections. Injections are normal hormones which are actually produced by the body. We give it in slightly higher doses to form multiple eggs. Normally a female produces 1 egg in a cycle, and in this we try and make around 10 to 12 eggs, which is the ideal number. So we give that injection for next 10 days of the cycle. In between, patient is called for ultrasound monitoring. On the ultrasound, we try and check how many eggs are forming, how is the follicular growth, how is the endometrium, should we increase the dose or decrease the dose. We actually titrate the dose accordingly. And once the eggs are ready, a final shot is given, and for 36 to 48 hours later, approximately 36 hours later, we retrieve those eggs under general anesthesia. Now, oocyte pickup, it's just a procedure, it's not a surgery. On that day, patient is asked to come empty stomach, and we give short GA for 10 minutes. A small injection is actually given in the hand and patient goes to sleep. Vaginally, the way vaginal ultrasound is done, along with that a needle is passed and eggs are aspirated. Eggs are something like water-filled balloon inside, multiple. So we give a prick and aspirate that fluid. That fluid is given to the embryologist. He takes a look at that and tells us whether the egg is there or not. So after the retrieval, patient is back to senses in 10-15 minutes. Patient is monitored for 4 hours because we have given general anesthesia and there may be slight sedation. So monitored in the hospital for 4 hours, and after 4 hours you can just go back home also. Now on that same day, patient's husband's semen is taken, embryo fertilization is done, embryo and sperms are mixed, and 48 hours, it takes 48 hours for the embryogenesis to happen. So after 48 hours, patient is informed how many embryos are formed. 3 or 5 days later, as per the case and the requirement, number of eggs, endometrium, there are many factors to decide which day transfer to be done. 3 or 5 days later, we put back 2 or 3 embryos. Rest of the embryos are frozen for the future use. So around 45 to 50% of the patients will conceive in the first cycle, but the remaining who don't conceive, they don't have to go for the stimulation again and again. That's the idea of making multiple eggs also. So from that same frozen embryos, again in the next cycle or maybe a month later, we can just prepare the lining, or in the natural cycle we can transfer those embryos, and again after 16 days pregnancy test is taken, and that tells us whether the patient is pregnant or not. Now after pregnancy also, IVF pregnancies are not different from the normal pregnancy. Baby is just the same. Only thing, because we have stimulated and we have given you medicines and some part is done outside, patient need to be supported for the first 3 months of pregnancies. So in IVF pregnancies, only for the first 3 months, you will be taking little extra medicine which is not there for the normal conception. After 3 months, you are just like a normal pregnancy, and the mode of delivery, the medication, routine, everything depends on any other normal delivery, normal pregnancy. So that doesn't matter whether you'll have a cesarean only just because an IVF. That doesn't it doesn't depend on what kind of conception you had. If you have any queries regarding IVF, you can reach us at CK Birla Hospital for Women. Details are there in the description. Thank you.